Good afternoon and evening, everyone, and welcome to the On Air Advocate. Where at the On Air Advocate, we provide education, advocacy, and support services for special needs parents, caregivers, and those with different abilities, mental health challenges, and chronic illness. For those of you who may not know me, my name is Tammy Flynn, and I'm the host of the On Air Advocate. And I am super excited if you are here joining us today live or whether you are catching this on the replay. Now, as always, if you think any of the content that we are talking about today could be relevant for anyone in your network or your circle, please hit that share button and share the love with others. Well, if you guys have been following along with us the last few months, you know that we have been doing a series on VEDS, which is Vascular Ehlers-Danlos syndrome. And so today I am very, very excited to welcome to the show this dynamic mother-daughter duo, Meg and Zoe, who are here to tell us their perspective and their story of both living with VEDS. Welcome, you guys.
Thank you.
Thank you.
So you guys haven't been on the platform before, and so I would love for the audience to get to know you guys a little bit. So if you could just share just a tiny bit, something fun about yourself, or I mean, I heard a tidbit of how many kids are in the house, so that would be something fun to learn too.
So I'm Meg. This is Zoe, the mother-daughter duo. Yeah. We live in Southern California, so it's nice and warm right now.
Mhm.
We have a very mixed, blended family. So Zoe has how many siblings? Five. So she's got 3 brothers at our house and 2 sisters at her dad's house. So Zoe has a lively family dynamic, and we definitely have a lively household. So it's one more component of our crazy life. Yeah.
Yes. And Zoe, what grade are you in?
I am in 6th grade.
Okay. And where do you fall in the list of siblings? Are you the youngest or the oldest, or are you in the middle?
Here at my mom's house, I am the 2nd oldest.
Okay.
At my dad's house, I'm the oldest.
Okay. So do you like being the oldest?
Well, my middle sister, Faradon, she's definitely more mature than me.
Okay. All right. So, because I hear a lot of times about them, for my kids, I have 4 children. The middle children don't always like being the middle children. You know, they like the younger, the older, you know, it gets a little more challenging. So, you know, I don't know. But let's dive into our topic for today, which is learning more about your experience and the journey you guys have traveled with VEDS. And obviously, Meg, this is going to start with you, right? From the very beginning. So take us through this story of how you even became aware of this. Did this run genetically in your family before you received it? Those sorts of things.
Sure. So my story started with VEDS really when I was 27. Neither one of my parents ended up testing positive for the condition, so I ended up having a spontaneous or de novo mutation.
Okay.
As a childhood,
like what that is.
Sure. So basically, I had a spontaneous, like in my development as a or fetal or embryonic or before that phase of development, there was a mutation in the collagen 3 or 3A1 gene where I developed the mutation on the COL3A1 gene. That is the gene that causes vascular Ehlers-Danlos syndrome. A de novo mutation means it happened spontaneously, so I didn't inherit it from either one of my parents. So it took testing for me to even have the diagnosis, and then to confirm that it was a spontaneous mutation when my parents tested, and both of their tests came back negative.
Oh, okay.
So, but I actually didn't, when I was 27, I didn't have genetic testing at that point, but I did have my first vascular event, which was an aneurysm in my left maxillary artery, which is right here. And I ended up having aneurysm coils to kind of occlude the aneurysm from rupturing and being catastrophic, basically. So I mean, in hindsight, looking back through my childhood and knowing the signs and symptoms of the condition, I definitely can pinpoint certain things. But really, I played sports. I grew up in a you know, I mean, I had some things going on when I was a smaller child. But from a vascular standpoint, there was nothing to really indicate there's something, genetically off, or from a collagen deficiency standpoint that would indicate that I had the condition until I had that aneurysm
So
at
it
age
was
27.
until 27 that you were actually diagnosed?
So that was when I had my first aneurysm. And when I was being discharged from the hospital, because they had done an angiogram to access the aneurysm to coil it,
Okay.
they saw that on my aortic arch, on a vessel that comes right off of the aortic arch, the innominate artery, I had a little like berry aneurysm that was there. So it was a red flag to them, and so they had said, "Hey, by the way, you have another aneurysm in your chest. You're going to want that followed up on." And the follow up that I had was, "Oh, we'll just monitor it." And for many years, 9 years exactly, I sought out more answers as to why a young healthy person could have these aneurysms. And at the time, I was in nursing school. So I have a clinical background, and I had clinical resources at my fingertips. And I basically got to the point, and this was, 2008, 9, 10, where genetic testing wasn't really at the forefront. It was something that was there, but it wasn't really accessible or
Right.
easy to get. And VEDS was definitely not something that was very familiar in the medical community
Right.
as
Right.
far as a reason, potential cause. So, so it took a long time for me to get that diagnosis, and it was really something that I sought out. And I was at 35 years old when I got the diagnosis.
Oh, okay. So
Yeah.
35.
So
And you were saying previously that there are things now when you look back at your childhood that make that all make sense. What were some of those things?
I think the biggest thing was easy bruising.
Okay.
Yeah. And I just didn't know that that wasn't normal for everyone. And I'm a little hypermobile with some of my joints. I was constantly injuring myself. I was very athletic, but I almost never finished a season of whatever I was doing because I would always get injured, and it was always injuries that were, not from doing much, like tearing meniscus or cartilage in my knee, playing a video game, or just silly stuff that doesn't happen to normal people. I just thought that I was really accident prone.
Okay. And like the easy bruising just from
Bruising, just thought I was like anemic.
your parents too, did they feel that same way? Just like, oh, things happen, or did they start to take you to the doctors to ask questions, but then the doctors didn't? Because I know a lot of doctors, because this is more rare, they're not as aware of it. So a lot of they think it's something else.
Yeah. So I was born premature. So I was 10 weeks early, and I think a lot of the health issues that I did have as a child were kind of all like, oh, maybe it was because she's a preemie, it was smaller. I had I had UTI infections all the time, but turns out one of the valves in the ureter didn't function properly or wasn't there. It's kind of a long time. I was so little, I don't really remember the exact issues, but I do remember being in the hospital, in the children's hospital, quite often. And now I'm thinking, yeah, that was all probably somewhat related.
Right. Because what was the year again that that VEDS really started to move forward? Where people started to have more research and knowledge of it.
So, I mean, how I actually heard about it was after. This bruising thing was really something that was bothering me. And obviously, having been a nurse for 10 years at that point, when I did seek out a diagnosis, I was, working with physicians, and even the physicians that I work with would make little comments here and there. Like I had blue sclera, or a tint, like blue tint to the white part of my eyes. And an orthopedic surgeon that I was working with at the time mentioned it. And, I'm, Googling Dr. Google and kind of putting all the pieces together. And I realized that it was most likely a connective tissue disorder. Because of the hypermobility that I did have, I thought, okay, it's probably Ehlers-Danlos syndrome, hopefully not the vascular type.
Right.
But I was basically doing a lot of online research, and this was about 2015 in my whole journey. 2015, yeah, because you were 5.
Yeah.
And one of the posters that I had read online was actually posted from a woman who's now a friend who lost her son. And one of the things, related to VEDS, and one of the things that she had posted was that if your child sleeps with their eyes open, and that wasn't something that I did as a child, but I realized that Zoe did. And that was one thing I wasn't really sure of. But when I was trying to put the pieces together for myself, and then when I saw that as one more manifestation, I just knew that it was VEDS.
So Zoe was already born before you had your diagnosis.
Right.
Okay. So how old was Zoe? Like, well, you were trying to find that out. How was she still a baby, a toddler?
She was 5. She was in,
Yeah,
she
2015.
just 5. Yeah. So I had, I'd had the aneurysm and known that I had the second aneurysm, still didn't have a diagnosis for why I had these aneurysms. So when I was married and, family planning discussions, I had got clearance from for my vascular surgeon that was kind of following me for the aneurysms, but everything was stable. But my OB at the time was, just erring on the side of caution. We just planned an elective cesarean section so I wouldn't be straining or putting any extra pressure on my vascular system. So that's how we had Zoe.
And so when she was born and you're seeking out, to kind of find some answers. Obviously, at that age, she didn't know the things that were going on. But what were some of those things that you were seeing in her at that time before she could recognize things?
Really, it was just the sleeping with the eyes open.
I bruised really easily too. Like I remember having tons of little bruises.
Like
on my
little
legs.
things.
Yeah.
Yeah.
Okay.
And
it showed more in my brother though. Like with veins everywhere. You could see it.
Yeah.
So, but Zoe, are you the only sibling? I mean, you're the only child that has it, or do you have?
No, my littlest brother, Izaak, he's 5, right?
Mm-hmm.
Yeah, he has it. Like,
as well.
Yeah.
So right after I got my diagnosis, I found out, I think 2 weeks later, that I was pregnant.
Izaak?
With Izaak.
Yeah.
Okay.
So it was a complete game changer. It was one of those, we were not, it was, we'd been actually trying to have a baby. We had the his, hers, and ours collection, and we were trying to go for the ours, or the his and hers collection, then trying to go for the ours. And once I got the diagnosis, it was, okay, we're not going to try anymore. And then found out I was pregnant. So, so that became, so my son, or Izaak, who's now 5, it was a high risk pregnancy. And then he was tested in the NICU and his results came back positive, since there's a 50% chance of passing it on.
It's very great. A real high chance as well. Okay. Now, for him, have they seen any signs? Have you seen signs and symptoms in him already?
Yeah, very much so. More than Zoe.
Yeah.
And did they say that the more children that you have, it may be more pronounced, or is it just?
No, and so they do have different dads. And so there's that component, but they both have the same gene mutation on the COL3A1 that I have. Okay. But as I've been as I've learned more about the condition, and now as my role in nursing, I work in cardiology with a specialist that specializes in cardiovascular connective tissue disorders. I learned that even within siblings with the same parents, same gene mutation, it can manifest very differently among siblings. So, and that is absolutely true with my two kiddos. And Izaak, almost from the moment he was born, you could just tell. We electively had him 6 weeks early. So it was a very planned, methodical, scheduled cesarean section, and I ended up having a scheduled cesarean hysterectomy. So I wouldn't have to go back eventually to have a hysterectomy because I was having, gynecological issues, and so it was kind of like a one-stop shop. Have the baby, get the reproductive parts out of there, and in the NICU, I mean, you could just tell. And I mean, maybe it was your typical NICU baby or early baby, but for me, as a mom, as a nurse, I just had that gut feeling that he was positive, and he was. And his skin is very transparent.
You can see the veins.
He's got veins on his forehead,
his chest.
He's had hernia surgery, in bilateral groin hernia surgery. He was 2 when he had that. He had a hydrocele repair. And maybe this was NICU too, or maybe more related to him being premature, but his lungs seemed to struggle. Every time he got sick when he was little, he would be really sick. We spent a week.
He gets sick a lot.
Yeah, and it's funny, since COVID he hasn't, because I think we've probably just been better.
Neither have I. I used to get sick a lot, but not anymore.
Yeah. But when he would get sick, he'd go from 0 to 60, and we'd be in the hospital for a week. So.
And he is 5 currently.
Yeah.
Okay. And right now, how is he? I mean, is it still the same things? Like, I mean, obviously you're not with people as much, so maybe not as much sickness. But is there that bruising that happens, easily?
The respiratory issues it's almost like he's kind of growing out of them, knocking on wood. But he definitely bruises easily he's boy. So boys are, a little different than girls as far as their activity and being rambunctious. And he's got older brothers. So when they play, I mean, he's falling, he cuts himself, he hits himself on the head. He's had staples in the head because bleeding doesn't stop. The head's a very vascular place. So it is definitely more of a concern. I mean, when she was diagnosed at 5, we were kind of past those scary, toddler years. And there were no incidents really with her. Not really. But with him, I probably get a phone call from his teacher or his daycare, probably once a week, just to, hey, Izaak hit his head. Just want to let you know, he's got a big bump or a big bruise or scratch or something.
Right.
And it's not your run of the mill bruise or scratch. It's always a little bit more concerning. And it's been a lot of education and communication with teachers and caregivers ever since he was born.
And getting them to understand the condition itself that he has. Now, Zoe, at what age do you think you were when you started to recognize that you had some of the things? I know you said you always recognize that you had like little bruises. Are there other things that you feel are different because you have it? I mean, that you experience?
Well, with you guys, with Izaak and my mom, you can see like the veins.
Yeah.
Like that's also something. But for me, you can't really see them that well. Like they don't show up. So I don't have that part. I still sleep with my eyes open sometimes. I don't get bruised as much as I used to, but I used to have a lot of bruises. That was pretty much one of the main things that brought it out for me. So, yeah.
So did you say you had bruising in your eyes as well? Was that what you were saying, or your eyes just you sleep with them open?
No, I sleep with my eyes open. I meant the bruises. I used to get a lot of bruises on my legs, like from school and stuff. Like most of the times I wouldn't even know how I got them. Like they just appear.
Okay. And do you have, aside from the bruising, is there any symptoms that you have on a regular basis, or are there any things you have to be really, really careful of, like precautionary measures that you have to take?
Sports and activity.
Yeah. Mainly sports. That's pretty much all I can think of, though.
Yeah. So there's the whole gastrointestinal component to VEDS too, because there's the risk for intestinal rupture.
Okay.
And so being constipated is risky. That's not something we worry about here, but
Right.
it is something that Izaak seems to struggle with more so.
Okay.
So
you have to be very, very careful with that, because when things get filled, they can just rupture.
Yeah.
Tissue.
Yeah.
Okay. And, you know, knowing things now, like we were kind of talking about before the show, all the different things that you've experienced and that you've learned, if you were to meet a new family that was just diagnosed, what would be some things that you think you would tell them? You know, like there's 3 important things for them to know or to be aware of or to maybe follow up on.
I think our internet connection was a little off, but I think I heard what you were saying or asking. I think what's really important from a parent standpoint is, or what I've learned, and my husband has been instrumental in keeping things balanced, is
Right.
keeping our children safe, but still allowing them to have a normal childhood as much as possible. And you can't cookie cutter rules for the masses. I think it really is an individual basis, and we can see that clearly with our 2 kids.
Mhm.
And so it's a balancing game to really ensure that they're safe and still able to have like a normal, not wrapped in a like bubble wrap. Because I think when we have a condition like this, we understand the severity of the situation and that this is a life-shortening condition. Okay, we know that. And the quality of life has to be taken into consideration when we know that life can be short. So, and that, Zoe mentioned something earlier. I think we were talking about emergency, being prepared for an emergency.
Yeah, you made sure, like when me and my brothers were like really young, you made sure that we knew how to call 911 and do CPR. And I was saying that I think every parent should know how to do it, no matter what.
Or teach their kids.
Yeah, teach your kids that at a young age, because it's a good thing to know.
Yeah.
Yes, definitely.
Yeah. So I think that the takeaway is to find the balance and making sure your kids are, get the routine care that they need. Stay safe, are aware, make sure people and caregivers are aware of the condition and the risks. But also let them be kids still, and, explore other options. Zoe could have been a really good football player, but you know what, that was just not in the cards. But we did Girl Scouts instead, and I was the Girl Scout troop leader. And just depending on her comfortability and or recommendations, and I guess the blessing of our physicians, Zoe plays volleyball now and she's padded up. And, after a while we let go of the pads because she wasn't bruising. Or there weren't any really adverse effects of her playing that sport. So,
yeah, I think mine has definitely improved a lot. So now I don't get bruised, so I can play volleyball. So when I hit the ball, it doesn't really hurt anymore because I got used to that. So that's good.
Now, do they say that VEDS can improve over time? I mean, you know what I'm saying? Like, can it improve or can it always kind of go south? I mean, is it?
Well, I'm glad you asked that, because I don't think that it can improve. In fact, I think for what you've just shared with the volleyball, I think it's more from an athletic standpoint. You've gotten better and gotten used to it. And I think that you're, from an athlete standpoint, you're able to protect yourself and play in a certain way.
Yeah.
But in general, VEDS is not really something that gets better over time. I think it actually is the opposite. And we know that because of the statistics, where we know that events, vascular or organ ruptures, those things tend to happen. They don't tend to happen until it's either someone's late teens, the 20s, or by the 30s. And so there's not a lot of events that happen as a child, though it's really important to be aware of the things that could happen, that there is an increased risk. But I think as patients with VEDS or people with VEDS get older, it is a little bit more important to kind of keep an eye on things.
Right. Because like you said, your first big episode that something happened, you were 27, right?
Right.
So that just speaks to that. Now, the VEDS organization, the VEDS movement that we're doing this series with, how did you guys find them, and what are all the resources that you guys utilize from them, or what they have to offer?
You're smiling. Did you want to?
No, do it.
So I was, I think probably because the nurse in me, and not knowing a lot of information when I was first diagnosed, I really wanted to become more involved in the community.
Right.
And I think it was a cathartic drive in me as well to meet other people that have the condition. Because it's such a rare thing. And even in the medical community, not having even clinicians that are aware and my colleagues that are aware, it really did mean a lot to connect with someone that could, understand what it's like. Oh, you have bruises and you don't know where they came from too. Like, oh, that is normal with someone else now,
Right.
And so there's a lot to be said about the kind of the healing process, and the psychosocial component of being involved in the community. And so having, I started getting involved in the community, and at that point it was just Facebook, and different Facebook groups. And so there were some biopharmaceutical companies that had shown interest in VEDS, and through those organizations, I became more involved and ultimately ended up meeting the leadership at the Marfan Foundation. And at that point, they had decided, hey, this VEDS is so similar to Marfan syndrome, like a cousin, Loeys-Dietz syndrome. And the clinicians are the same, the struggles are the same, or very similar. And so I was involved in I was on the steering committee to even start the VEDS movement. And I'm just flabbergasted by how much this organization and the leadership has been able to do in such a short amount of time, because the resources that the community has now is all in one place. And we have professional advisory boards full of physicians that have been treating this condition since its infancy, really. And the community resources, the resources just for teachers and caregivers, and the emergency planning list. It's just remarkable. So that the VEDS movement has just been exactly what this community has really needed, because I think as people I would say in the last 10 years have been diagnosed, there's a lot of effort, making aware, or having awareness, increasing awareness, but to operationalize that and actually have a standardized recommendations and messages across the board that are evidence-based and backed by the experts in the field that's just what we've needed from day one. And I think that will go ahead.
Through the website, there is, so you're saying that there's supportive services for teachers, for caregivers, for family members, siblings, whatnot, activities that way to get more information, to help you seek out a doctor. Do they have that on there as well?
Yes, there's an institutional directory board, so you can find a clinician that is that really is qualified to diagnose, treat. There's I think basically from the suspicion of the condition, confirmation with genetic testing, and what to do from here. Now that you have a diagnosis, now what do you do?
Right.
What are your resources? And emergency preparedness is a huge thing, because that's what this is about. I mean, these things don't, most of the events, I would say most of the events that come up, they're emergency. They're not something that, that are, I guess,
Minor.
Yeah, they come up and they're big, and that, or they could be. And so you go to the emergency room, and a lot of, because of the rarity of the condition, I mean, triage nurses and physicians in the emergency room, they haven't heard of it. They may have heard of the other types of Ehlers-Danlos syndrome, but not necessarily the vascular type. And the vascular type is the most severe type and life-threatening. And so the standard emergency room care is not necessarily appropriate for what we would be experiencing. So having those resources at our fingertips at any given moment is critical, and literally can be life-saving. So.
Yes, and I'm going to drop after this the website below. So whatever social media application you're viewing this from, you guys will be able to hop on and be able to get over to the VEDS movement website there. And yes, and they pair up with Marfan, which was very, very nice. We did a Marfan series. And so those that are trying to learn about it, they do have so many similarities. So that series is also on our YouTube channel if anyone wants to check that out as well. But with that, Meg and Zoe, I thank you guys so much for coming and sharing today. Before we log off, is there anything though that you'd like to leave the audience with, or that I forgot that you want to make sure to say?
What do you think? She has no idea. I just want to say thank you, Tammy. I really appreciate you doing this series. I think the more awareness and the more normalcy we can bring to this, it's just going to really, really help our community, and not just our community, but other conditions that are rare. So thank you so much. And thank you to the VEDS movement and the Marfan Foundation for giving us this opportunity and giving us the hope and resources that we've really needed. So we appreciate you. Thank you.
Yeah. And I appreciate you guys spending this time with me today as well. So if you guys want to know more about the VEDS movement, like I said, I'll drop that below. And then also, if you want to know more about the On-Air Advocate services, you can go on over to onairadvocate.com and you will find all of them right there. So thanks again. Look at me. It's not even Friday yet. Thanks again, ladies. You guys have a wonderful rest of your day, everyone. Thank you. Bye, guys.
Thank you.
Bye.
Bye.